story for all of you guys. I went undercover in the federal prison system to check out what the healthcare system is really like for prisoners. So, wait a minute and we'll get on with our program. For comedic relief, we over-dramatize stereotypical attributes of inmates. So, with that in mind, please sit back, relax, and enjoy the show.
When an inmate first arrives at the prison, they are supposed to receive a full health screen examination within the first 14 days of their arrival. The staff is also supposed to review all of the medications that the prisoner was taking prior to being incarcerated. This will help to determine the medications that are necessary to be continued while the inmate is incarcerated.
Ouch. My heart, and my lungs, my thoracic. So after the encounter that you guys witnessed from our lovely security cameras, my primary care provider team told me that I fractured my ulna in 8 different places, and I just gotta tell you that sucks, because now my street cred out in the yard is knocked down about 7 different levels, and that is not good. Oh, there comes, okay. So I'm new to this whole prison healthcare system thing. Can you tell me how it works?
Basically, if you are incarcerated for either a year or more from the Federal Bureau of Prisons, you are eligible to receive mental, medical, and dental health services.
Sick. Word to your mother. Still a little bit hazy on how all of this works. Can you break it down for me just a little bit more?
Okay, so in the federal prison system, there are 4 different levels of care that you can receive.
Care level 1 is when the inmate is generally healthy and less than 70 years old.
Care level 2 are for stable inmates but need quarterly exams, so a little bit more care than the relatively healthy person would need.
Care level 3 is there's more frequent examinations and hospitalization could occur with the inmate.
And care level 4 is strictly for patients who require more advanced medical services such as dialysis or active cancer treatments and things like that.
Alright, so I'm still really confused as to what's going on here. I think I'm at care level 1, but other than that, I don't know how to break it down. You know what I'm saying? Can you help me out just a little bit more?
So within the system, there are 5 different levels of medical intervention that can happen.
The first level is medically necessary, acute, or emergent. And that basically says that if your injury is not treated right away, that it could be life-threatening.
On the other hand, there's medically necessary but non-emergent, meaning that although it won't be life-threatening, it does need to be treated.
Next is medically acceptable, and this is where it's not always necessary, but it's needed to improve your quality of life.
After that follows limited medical value, so the patient would not be needing care to have a long-term outcome, but it could help the patient for personal gain. So it's usually not going to be approved.
The final level is extraordinary, and this level is only used if it affects another inmate's life, such as like an organ transplant.
Alright, thanks homies. Alright. So, since I fractured my ulna in 8 different places, what category do I actually qualify under?
For that, you would qualify under the medically necessary non-emergent.
You're under this category because your injury is not life-threatening, but if not treated correctly, it could affect your activities of daily living.
In order for an inmate to receive any additional health care, such as physical therapy, speech therapy, etc., they must first be seen by a mid-level practitioner, such as a nurse practitioner or a physician's assistant. If the mid-level practitioner decides that some form of specialty care would be beneficial for the prisoner, the inmate must next visit the staff physician. After seeing the mid-level practitioner, the staff physician will then decide and refer the inmate to a specialist if they see fit. If any non-emergent service is recommended, the Utilization Review Committee will review the case and decide whether the inmate may receive the care that has been recommended for them.
In the criminal justice system, the people are represented by two separate yet equally important groups: the police who investigate crime and the district attorneys who prosecute the offenders. These are their stories.
Alright, so they explained to me how to navigate the system a little bit, and that's all fine and dandy. But I gotta say that this healthcare system sounds really different than what I experienced on the outside. So, with that being said, can you guys tell me like why this whole thing started and like what created this system and why it was implemented?
So because the vast majority of prisoners are going to be released back into society, it would be in society's best interest to provide them with proper health care while they're in prison so that when they are released back into society, they wouldn't become a financial burden.
For 3 decades, the courts protected the constitutional right of health care for prisoners. The Supreme Court case Estelle v. Gamble of 1976 ruled that by depriving prisoners health care, it was cruel and unusual punishment, thus violating the 8th Amendment. This also prohibited the prison staff from ignoring the prisoner's condition that they needed care. This was also a mandate for all those in custody, whether convicted or not.
Thank you, ladies. I appreciate your information. I feel so knowledgeable now. Ah, my arm.
Although the Supreme Court mandate requires healthcare services for all inmates, there is still a high number of those who suffer different disorders in comparison to the rest of the nation's population. For example, the hepatitis C has an infection rate of 15 to 30% of the entire inmate population. This is substantially higher than the 2% infection rate in the non-incarcerated population. Another example is the AIDS confirmation, which is 3 times higher in the federal prisoners population as compared to the United States general population. People involved with the criminal justice system are generally low income and uninsured. One survey from 2002 showed that nearly 6 in 10 inmates reported a monthly income of less than $1,000, and the majority of these individuals were uninsured. These individuals also face a variety of social challenges. The rates of poverty, unemployment, lower education levels, and homelessness are generally higher in the criminal justice involved population as compared to the general United States population. The Affordable Care Act offers new opportunities to increase health care coverage among those transitioning back into the community by expanding the Medicaid eligibility to nearly all adults with incomes at or below 138% of the federal poverty line. The federal Medicaid law prohibits the payment of federal Medicaid matching funds for the cost of any services provided to an inmate of a public institution, except when the individual is a patient in a medical institution. This policy does not prohibit individuals from being enrolled in Medicaid while incarcerated. However, even if they are enrolled, Medicaid will not cover the cost of their care except for care received as an inpatient in a hospital or other medical institution. By expanding coverage to the criminal justice involved population, it may offset the state's spending. Prior to the Affordable Care Act, only a few states pursued Medicaid reimbursement for health care services because only a limited number of inmates qualified for Medicaid. The Medicaid expansion provided by the Affordable Care Act offers reimbursement for any inpatient services provided in an incarcerated individual. The Affordable Care Act's Medicaid expansion allows individuals to enroll in Medicaid so that they are insured upon their release, thus reducing the financial burden of being uninsured. This also provides opportunities to increase healthcare coverage of this population to improve their access to care and contribute to more stability in their life.
So I've noticed you've been taking notes. What are your views on the healthcare system in federal prison?
Well, let me first off just start by saying they were very kind to me and they lent me this iPad so that I could record my findings and kind of put it all together so I could really collect my thoughts. But I would have to say that as an inmate, it's comforting to know that if I had some sort of major ailment, that I could receive some form of care. Yes, there are some drawbacks that I've noticed, but it's nice to know that there is a system in place for me to utilize. A lot of times they did say that if it's approved by the Utilization Review Committee, we can receive some elective procedure treatments that aren't under the medically necessary umbrella, but those hardly ever get approved, which is kind of not the best to know.
So you like a lot of the aspects of the healthcare system, but what are some of the negatives you've noticed?
Let me tell you, there are quite a few weaknesses in this system, just like in the regular healthcare system that is seen on the outside. I know a few people who have only received any form of checkup or preventative measures on one occasion, and that was when they were originally incarcerated and being put into the system. I've also heard of certain instances in a case study where some inmates had been seriously injured and they received no form of care whatsoever. Granted, that's pretty drastic, and it said it was only seen in 7.7% of the prison population, but that's still startling to hear. It can also be seen as a negative where inmates, like myself, aren't granted access to all of the preventative care that we may require. If certain conditions aren't categorized under the certain levels that allow us to automatically receive care, we may just have to wait it out before the condition either A, clears itself up, or gets to the point where it's so bad that we are required to have care before we die. And that's awful. I don't want to die. I'm rambling.
So, anything else you'd like to share?
Well, I've also heard that it's kind of hard to find physicians in hospitals to partner with prisons to take care of the inmates. It's been said that a lot of the restrictions and requirements for the doctors kind of make it pretty difficult. So things like travel, working conditions, limited resources, and payment seem to be pretty big factors that play a role in the decision making for those physicians and hospital corporations. And if we don't have doctors, we don't get treated, and then we all die. I just found out some big news that I think everybody needs to know. First off, sorry about the news slang. Spilled Sloppy Joe all over it in the cafeteria, but that's besides the point. Getting it dry cleaned. Okay, back to it. So I hear that in the federal prison system, there's really variable ranges of quality of care for substance abuse and other mental illnesses, which is not good to begin with. Then, if you couple that with the high budget costs and all of the extra spending that they do in the federal prison system, compared to out in the community, it's awful. How does it make sense that they have more cost but less quality of care? I don't know.
For Channel 5, this is Curtis Smith along with our undercover reporter, Katie the Small Stuff House. Thank you for watching our undercover documentary of the prison healthcare system. That is all. Stay classy, and we will see you next time.
Oh, is it going?
Yeah, go.
Oh, okay. So,
Are you guys going already?
I don't know.
For more than 3 decades, the courts protected the constitutional right for health care.
Bad, because now my street can frick my grill. Redo. All die. There's a lot of death in the prison healthcare system.
And that's bad.
I shouldn't say that, but
What are we doing?
Asade.
So,
So, let's go on an adventure. Adventure!